Being healthy, what is shortening and diminishing the quality of life in Jefferson County? A brief look at the connections between death, disease, and behaviors. This video was created by Jefferson County Public Health in Colorado in connection with their community health assessment process. Which brings us to Jefferson County's Health Connections model. Jefferson County Public Health believes that when community members engage with health data, notice trends, and choose health concerns to track, they will better understand the health issues facing our county and will want to get involved in creating solutions. Our model creates a visual way to share this information. We start by looking at the top causes of death in Jefferson County in 2011. In 2011, the top causes of death were cardiovascular disease, cancer, unintentional injury, chronic lower respiratory disease, and Alzheimer's disease. So exactly how many people died in 2011 from these diseases? Let's look at the proportion that each of these causes contributes to all deaths. We start by looking at this large gray circle, which represents 100% of all deaths in Jefferson County in 2011. The smaller green circle is all of the cardiovascular disease deaths, or 24.2% of all deaths. So if we look at the top 5 causes and how they contribute to all deaths, we have the top causes of death, starting with cardiovascular disease, 24.2%. Cancer, 21%. Unintentional injury, 7.3%. Chronic lower respiratory disease, 6.8%. And Alzheimer's disease, 4.6%. This is the first piece of our Health Connections model. We will come back to this in just a bit. The next step is to determine how people get the conditions that kill them. Many factors contribute to cause of death. Here are a few simplified examples. We know that many factors contribute to an individual's health. These impact the development and progression of diseases. Sometimes one disease may lead to another, like the conditions in orange. Sometimes an exposure or behavior will lead to a disease or death. We have health concerns like Alzheimer's disease, diabetes, infectious diseases, hypertension, overweight, and obesity. And there are risk factors that include behaviors and exposures like access to appropriate care, alcohol use, unhealthy diet, physical inactivity, and tobacco use and exposure. This example showcases 5 health concerns and 5 risk factors and behaviors that are connected with the top 3 causes of death. Notice that this is just an example and not a complete list. The arrows show the connection between the health concerns and risk factors and the cause of death. Let's look at one of the health concerns, Alzheimer's disease. Alzheimer's affects the ability to balance and contributes to unintentional injury, like falls in older adults. Now let's look at a risk factor. Access to appropriate health care is important for the detection and treatment of cancer and heart disease and treatment of unintentional injury. If we follow the arrows, we can observe how the health concerns and risk factors contribute to these 3 causes of death. Let's look at just one risk factor as an example, physical inactivity. Now we will expand this model and look at the top 10 causes of death. On the left, we have a list of health concerns. On the right is a list of risk factors that includes behaviors and exposures that are known to contribute to the top 10 causes of death. For this example, we will be looking at only one risk factor, physical inactivity. we will show how physical inactivity is connected to the top 10 causes of death and the health concerns. We have then physical inactivity as our risk factor in the dark green. The gray circle represents the top 10 causes of death, and to the left we have a list of health concerns. Now we will show how physical inactivity is a risk factor to the top 10 causes of death. As you can see, physical inactivity is a risk factor to most of the top 10 causes of death. Now you will see gray lines. These show the connection between physical inactivity and the top 10 causes of death. As you can see, most of the top 10 causes of death are connected to each other as a risk factor. If we look a step further and link physical inactivity directly to the health concerns, we see that physical inactivity is a risk factor to hypertension, obesity, and being overweight, as well as many other health conditions. Now the light green arrows will show how these health concerns contribute to the top causes of death. Asthma is a risk factor for chronic lower respiratory disease, influenza, and pneumonia. Depression is a risk factor for suicide. Abnormal cholesterol levels are a risk factor for heart disease and diabetes. Next, we add in the rest of the connections, showing how interconnected all these health concerns really are. Here we can see that just one risk factor, physical inactivity, is connected to many health conditions and to all 10 of our top causes of death. And the Health Connections model does not stop here. These new black lines show how the causes of death are also known risk factors for the development of other health conditions. Chronic lower respiratory diseases are linked to an increased risk of infections and depression and hypertension. Finally, many of those health concerns are risk factors for other health concerns, which are shown by the black lines. As you can see, a single behavior like physical inactivity can impact our health on a grand scale. So, what do you think? Is physical inactivity shortening and diminishing the quality of our lives? Physical inactivity makes us sick. Physical inactivity decreases our quality of life. And it is not the only thing. Remember, physical inactivity is only one of the risk factors that contribute to poor health outcomes. However, there is good news. Physical inactivity is decreasing our quality of life, but it is preventable. We can replace physical inactivity with physical activity and shrink disease and death. Let's look again at our first model. Now we replace physical inactivity with activity. And where before we saw physical inactivity causing disease and death, we can now see how physical activity decreases these negative outcomes. So, Increasing physical activity increases health and decreases disease and death. Let's all get active and get involved in creating a healthier Jefferson County. Visit our website, www.healthypeoplehealthyplacesjeffco.com.